HCPCS H0035 partial hospitalization is a Medicaid code. Send it to a payer that wants the commercial S code, and a full day of PHP gets paid nothing. The clinical day was correct. The code on the claim was wrong for that payer, so the claim does not pay. H0035 mental health partial hospitalization, treatment, less than 24 hours. Here is the billing reference for operators and billers. We cover the definition, the per diem unit, which payers accepted, its relationship to S0201, and the documentation that protects the claim. H0035 describes mental health partial hospitalization, treatment, less than 24 hours, a structured day of PHP programming. It covers structured daily mental health programming at partial hospitalization intensity, delivered for less than 24 hours per day. H0035 is billed per diem. 1 unit represents 1 day of PHP attendance. Partial hospitalization is the highest intensity of outpatient care, before inpatient or residential treatment, typically 5 or more days a week. H0035 is the Medicaid code for partial hospitalization. S0201 is the commercial S code for the same service. Match the wrong one to the payer, and the day does not pay. State Medicaid programs use H0035. Commercial and private payers use the S code S0201, which Medicare and Medicaid do not recognize. S0201 and H0035 should never both appear on the same claim for the same patient on the same date of service. A generic EHR won't tell you which partial hospitalization code a payer expects. Behave Health's platform is designed to submit the right code for each level of care. The platform is designed to align the code on the claim with the payer and the level of care, so a PHP day goes out under the code that payer accepts. Surfacing a code-to-payer mismatch before the claim is sent is how programs stop losing a full day of revenue to a preventable rejection. 4 factors decide whether an H0035 claim holds up at submission and at audit. Miss any one, and you risk a rejection or a recoupment. Let us walk through all 4. Requirement 1. Match the code to the payer. State Medicaid programs expect H0035. Commercial payers generally expect the S code, S0211. Some commercial payers also accept H0035, particularly those that do not recognize S codes. Verify each payer's preference. Requirement 2. Bill the per diem correctly. H0035 is a per diem code. 1 unit equals 1 day of PHP attendance, not an hourly or per session charge. Never submit both S0201 and H0035 for the same patient on the same date of service. Requirement 3. Document that the patient needs partial hospitalization intensity. PHP programs must demonstrate that the patient requires more intensive service than an intensive outpatient program provides. Some commercial payers require documentation that the patient meets inpatient-level criteria but can be safely managed in a less restrictive setting. Requirement 4. Know your state's partial hospitalization criteria. State-by-state variation in PHP admission criteria is significant. What qualifies for H0035 in one state may not qualify in another. Partial hospitalization typically requires 5 or more days per week, a structured programming lasting at least 4 to 6 hours per day. Partial hospitalization is often confused with intensive outpatient at billing time, but they are distinct levels of care with distinct codes. The key distinction is service intensity. Partial hospitalization requires more hours per day and more days per week than intensive outpatient. Bill the level of care the patient actually received. Coding a partial hospitalization day at the lower level leaves revenue on the table. Behave Health connects your level of care to the code on the claim, so partial hospitalization days go out correctly the first time. The platform is designed to align the partial hospitalization code with each payer, reducing the payer mismatch rejections that cost a full day of revenue. Per diem units are designed to follow daily attendance, so 1 day of PHP maps to 1 billed unit. Level of care documentation is captured alongside the claim, supporting the medical necessity a PHP day requires at audit. Stop losing partial hospitalization days to payer code mismatches. Book a 20-minute demo at behavehealth.com. See Code to Payer Logic and Per Diem Capture built for behavioral health billing at behavehealth.com.